We are Group 1, and we are acknowledging and addressing the health disparities for migrant farm workers. So a migrant farm worker is any individual who leaves their permanent residence to work in agriculture somewhere else. A majority of these workers in the United States are young Mexican males who come to the country alone and send money back to their family. More than half of these workers also don't have legal status in the United States, which has implications in understanding health needs and true numbers of their population, which tend to be given in estimates. As of 2019, there are somewhere between 1 and 3 million migrant farm workers in the United States, and as of 2020, there are over 160,000 living and working in the state of Kentucky. Next slide, please.
So when migrant farm workers come to the U.S., their whole intention is to earn as much as possible, as quick as possible, so they can send that money back home to their families. So this means that they end up working from sunup to sundown every single day possible, and this is all that their life really revolves around. So with that being said, an everyday routine that revolves just around their work means that other important aspects of their lives, like self-care and eating nutritious meals and education and other things, often fall to the side. So that means that it's important for healthcare providers to consider these things, like their working conditions being demanding and dangerous, their work schedule not providing for a lot of extra time, lack of transportation, their limited access to self-care items, clean living conditions. All of this needs to be thought of by a healthcare provider and have interventions like mobile clinics. Next.
Education is also something that's really unique in this population because often they face a very unstable learning environment. The state standards vary a lot by state. So when they're moving from Florida to North Carolina to Michigan, they're going to repeat some of the same content and also miss other critical content. Another issue that's faced in high school education is that the dropout rates are very high because the lure of being another income for their family is too high for a lot of students. And this has implications long-term on their health because one thing that's critical to mitigating risk factors for disease and then managing long-term health conditions is your ability to understand your disease process and what you can do about it. So it's important to educate this population and ensure understanding so that they can take control of their own health.
With this population is recognizing that they face specific challenges and circumstances that directly threaten their health, such as the environmental factors. So these things such as the chemical hazards via pesticides and herbicides on the farms, air pollution from the diesel of tractors and fires and chemicals, lack of adequate clean drinking water, extreme temperatures, all of these lead to different health conditions such as, so with those extreme temperatures, we see heat exhaustion, dehydration, that lack of adequate clean drinking water leads to lots of infection, and the chemical hazards and air pollutants showcase lots of links to different cancers and other respiratory illnesses. So it's very important for our healthcare providers to educate our patients on these things, such as clean hygiene practices, adequate water intake, recognizing signs of heat exhaustion, and identifying any ways to reduce exposure to those toxins.
One population-specific healthcare access disparity that's important to consider is cost. In the 2015 National Agricultural Worker Survey, high cost was listed as the #1 barrier for migrant farm workers accessing healthcare. And in this same survey, only 32% of respondents said that they had health insurance either purchased individually or provided by their employer, which meant that most were paying large sums of money out of pocket for each doctor's appointment. And this compromises the social determinant of health, healthcare access, and quality. Access-wise, these workers have to perform a cost-benefit analysis each time that they consider using a healthcare service, just to determine if their illness or injury is actually severe enough to risk spending upwards of 10% of their monthly income on a single appointment. And unfortunately, high-quality providers, specialists, and facilities also come at a higher cost, making them less accessible to individuals who are of a lower socioeconomic status, like migrant farm workers. And the only way to address this problem right now is by making healthcare costs less out of pocket and insurance more affordable without compromising healthcare quality, which is really addressing a systemic issue rather than a local one. A second key access disparity is transportation. Migrant farm workers face several obstacles when they're being approved to access their own transportation, including obtaining a license, understanding English, physical assessments, and facing high costs of vehicles and insurance. This influences two social determinants of health, including transportation safety and healthcare access. The strict rules that are required to obtain a license and own a vehicle make it more likely that people will rely on unsafe modes of transportation, like two-seat flatbed trucks, to travel long distances, which is really, really unsafe and really dangerous. Unreliable transportation also negatively impacts access to healthcare because reliance on others limits the ability to travel outside of certain geographic boundaries and therefore access resources outside of those boundaries. Some potential solutions to this problem include improving affordability of insurance, providing telehealth services to completely remove transportation altogether, offering services of mobile health clinics, and establishing public transportation between rural communities and healthcare centers.
So this population faces several key health problems, one of which is type 2 diabetes. So we can all pretty much put these puzzle pieces together of why this happens, of their poverty, their lack of transportation, lack of time, focus on their work. It all leads to these poor dietary options. And we all know that can then lead to the development of type 2 diabetes. It's also important for healthcare providers that they consider their patients' culture, which in this case, the Hispanic culture does have folklore surrounding diabetes, along with negative views of insulin. So when caring for these individuals, healthcare workers need to make sure that they provide preventive education on healthy eating, and then also working on their accessibility to the medications that they need and healthy foods once again. Next slide, please.
Another issue with this population that they face is high rates of injury and disability, which is really just related to their work in the agriculture industry. Because of the hard physical labor that agriculture workers do on a daily basis, there's just a very high risk for injury. So it's important to educate this population on ways that they can care for themselves and their community in caring for lower grade injuries or different chemical exposures. But it's also important to advocate for change on a broader scale as far as the enforcement and the creation of safety codes for these farms so that workers can be protected from injury to begin with.
So migrant farm workers, as we know, lead strenuous lives, but they also lead lonely lives because, as we said before, that these are usually single Mexican males, and this can all have a sizable impact on their mental health. In the diagram, we can see that the stress over immigration status, poverty, constant relocation, separation from family and friends can all lead to the development of depression and other mental illnesses. And probably the best way for healthcare providers then to acknowledge this and then work on improving that is by simply incorporating mental health services in all visits with this population.
So two recent technological advancements that may make a difference in healthcare access for migrant farm workers include telehealth services and CIRCOM. Telehealth appointments are more popular than ever now since the start of COVID-19, and the benefits for rural populations like migrant farm workers are significant. Through these services, patients may receive monitoring for chronic health conditions and virtual counseling. And many migrant farm workers have greater access to electronic devices than to reliable transportation. Additionally, because of their migratory nature, these individuals can be treated by the same provider for a prolonged period of time, which removes geographic location as a barrier to receiving health care. Second, CIRCOM is a phone and video interpretation service that is used in many healthcare facilities to improve access to interpreters, and it's used at UK Healthcare. It allows easy access to interpreters for anyone who prefers communication in a language besides English, and use of this service may help to address language barriers in healthcare settings and improve the likelihood of seeking care without fear of not being understood.
In summary, migrant farm workers' ADLs influence access to healthcare. Education barriers and environmental factors such as chemical hazards and air pollution not only get in the way of accessing healthcare, but also result in negative health effects. Migrant farm workers are unable to pay the cost of healthcare and have limited access to transportation. These lead to barriers in getting to doctor's appointments and receiving hospital care. Type 2 diabetes is very prevalent in this population. This results in many factors because of their diet and low socioeconomic status. Due to their isolated lifestyle, migrant farm workers also combat mental illness. Some solution to accessing healthcare are telehealth appointments. These are appointments that can be done online to relieve the transportation access barrier. They can also use Seracom, which is an online interpreter that relieves the language barrier. So these interventions absolutely need to be considered now for this unique population. Please feel free to ask questions, and thank you for listening.